Which legal cases define a patient's right to refuse treatment? Imagine being in a hospital bed, unable to speak for yourself, but still holding the power to decide what happens to your body. That's the core of the right to refuse treatment. This right is rooted in several important court cases that have shaped how healthcare respects patient choices today. These cases show that patients have the authority to make decisions about their own medical care, even if it means declining life-sustaining treatments. The first major case is in Ray Quinlan from 1976. Karen Ann Quinlan was in a coma after taking drugs, and her parents wanted to remove her from a respirator. The court agreed, setting a precedent that individuals have the right to refuse life support if they are competent. This case made it clear that personal autonomy extends to end-of-life decisions. It was a turning point, emphasizing that patients can choose to stop treatments that keep them alive if they believe it's in their best interest. Next is Bouvier v. Superior Court from 1986. This case involved a woman named Elizabeth Bouvier, who was mentally competent and wanted to refuse feeding tubes. The court ruled that her autonomy was more important than hospital policies. It clarified that refusing treatment is not the same as suicide, and patients have the right to make such choices without fear of legal repercussions. The court also recognized that a patient's own idea of quality of life is a valid reason for refusing treatment. Then there's Cruzan v. Director of Missouri Department of Health from 1990. Nancy Cruzan was in a persistent vegetative state, and her family wanted to stop artificial nutrition and hydration. The Supreme Court upheld her right to refuse treatment, stating that patients or their surrogates must be able to prove their wishes clearly. This case established that individuals have a constitutional right to refuse life-sustaining care, especially when they have previously expressed their wishes through an advance directive or conversations with loved ones. Other cases like Rees v. St. Mary's Hospital and Medical Center reinforced that competent patients can refuse medications like antipsychotics. The United Kingdom's case Aintree University Hospital's NHS Foundation Trust v. James in 2013 also confirmed that a patient's values and preferences are essential in making end-of-life decisions. All these cases show that the legal system recognizes a person's right to refuse treatment. This right is based on respecting individual autonomy, the idea that each person should decide what happens to their own body. It applies to treatments like artificial nutrition and hydration and is valid even if refusing treatment might hasten death. Healthcare providers are protected when they honor a competent patient's refusal, as long as the decision is informed and voluntary. These rulings highlight that patients are not just passive recipients of care but active decision-makers. The law supports their right to define what quality of life means for them and to refuse treatments they find unacceptable. However, challenges still happen, especially when hospitals or laws try to override these choices. Cases like these reminded us that respecting patient autonomy is a fundamental part of ethical medical practice and patient rights.